This is another patient with a GFR of 30. This woman presented with a cystic lesion on T2, which appeared to have a solid component centrally. Obviously, she had a CT to begin with, which was not terribly useful, although the cyst was not low density, so that raised some initial concern, which is why she wound up with the MR. Again, even on power Doppler, we were able to see that there is a solid component here with some flow, which enhances dramatically on the contrast and after contrast injection. Here you can see again this dramatically enhancing component of this malignant renal mass. This turned out again, given the very, very high vascularity, this did turn out to be a partially cystic clear cell carcinoma. This is another interesting patient where contrast was very helpful. On the grayscale evaluation, this patient was on chronic dialysis and had multiple cysts within the kidney. On grayscale evaluation, we saw this area of solid material within a cyst. Obviously, this was unable to be differentiated as to whether this actually represented a hemorrhage, for example, into a cyst, or potentially a tumor. These patients do have a propensity to develop renal cell carcinomas. And on the ultrasound, you can see here that there is maybe a septum in here, but this is largely an avascular area. You can see the grayscale appearance of this here, and this represented a hematoma within a small cyst in this dialysis kidney. This is another interesting patient with a somewhat indeterminate mass. This mass was relatively high density on non-contrast CT. You can see here that there was enhancement after contrast, but less than 15 Hounsfield units, and the clinicians were somewhat concerned about this. This is kind of scary on the ultrasound because I must say if I were actually to just look at this on non-con, I would probably have chalked this up to some backscatter in an otherwise simple cyst. You can clearly see here that this enhances and did turn out to be a renal cell carcinoma. Another simple thing that we do here is a patient with a history of malignancy with a PET CT, an area of low density here with no enhancement following the agent injection of the fluoro-FDG, and clearly this turned out to be a simple cyst on contrast ultrasound. One of the areas that you can also look at is the finding of renal vein thrombosis. We found that this tends to be somewhat challenging on contrast. Potentially we don't have enough experience with this yet, but you can see that there are some defects within this area of the renal vein corresponding to this large thrombus seen here on the contrast enhanced MR. This is a patient with a very large, remember when these RCCs become very large, they may cut off their own blood supply and become partially necrotic. You can see that this kidney is kind of splayed all around this very large enhancing mass, which has a large area centrally of necrosis with no vascularity. Very similar to what is seen in this patient who did eventually have a CT with contrast. You can see this large, relatively non-enhancing area centrally. You can see that there's a lot of disorganized vascularity here, and again, just this very small or thin shell of displaced renal tissue more peripherally. There, rarely we may see oncocytomas. There is a recent article actually describing the features on contrast of oncocytomas. This is a surgically proven oncocytoma. You can see that it has this kind of blotchy area of central low area of low enhancement. And although, again, not specific, this is something that might suggest the presence of an oncocytoma, very similar to, again, what is seen on the CT with contrast. In these kinds of patients, It may be, depending upon the clinician, they may want to simply remove them, but it would be potentially something upon which one could perform a biopsy and avoid surgery. Another interesting group of patients is shown here. We have a very large urology group. We have a urology group that sees large numbers of patients, and they are well known for their partial nephrectomies. Obviously, while rare, there is the possibility of local recurrence after the nephrectomy for their renal cell carcinomas. Again, the problem in these patients is oftentimes they will have abnormal GFR. This was 50, which is below the level that we typically would like to perform contrast on these patients, either with CT or MR. But on the lateral, on the axial view, there's this mass-like low-density area here. You can see some surgical clips. And of course, the question was, are we dealing with a tumor? On the contrast ultrasound, you can very nicely see that this actually represents probably a small seroma. And that there is absolutely no abnormal areas of enhancement in this particular case. So it's going to be very, very useful, again, particularly as many of these patients will suffer from impairment of their renal function and are unable to safely undergo CT or MR. Another interesting use of contrast in closing is that of guiding a biopsy. This is something we've only occasionally done, but you can see that there's this rather poorly defined mass on CT in the upper pole of the kidney. On ultrasound, there was a suggestion of a mass, again, in this region in the medial portion of the kidney. The patient and the clinician did not want to undergo a nephrectomy or even laparoscopic resection until they were certain of, number one, was it really there, and number two, what was the cell type. Interestingly, when you look at this on contrast-enhanced ultrasound, you can very clearly define that there is a hypo-enhancing mass in the same region, and it's certainly much better defined than on the non-contrast CT or non-contrast ultrasound. We eventually then were able to use this as a guidance technique to perform a biopsy of that specific area with much greater confidence than we would have had we not had the contrast-enhanced ultrasound as well. This actually turned out to be a transitional cell, which did, of course, alter the surgical technique. So we've had a very good run in the last couple of years with contrast ultrasound in the kidneys and the liver. We're using it in several other areas at this point, and I'm hoping that before too long, this will be something that is more widely applied than it has been in the past in the United States. Thank you.